This is around 47. Okay, mabilis lang to. Okay, this is our outline. And I'll just go straight into it. Okay, ano yung clinical presentation ng OCD? These are time-consuming, intrusive thoughts, rituals, preoccupations, and compulsions. Obsessions. What are obsessions? Intrusive and unwanted. Pumapasok sa isip mo, hindi mo naman siya gusto. Okay? Repetitive thoughts, urges, or gigil, no? Or impulses that often lead to a marked increase in anxiety or distress. The compulsions naman are done in order to relieve them of the obsessions. Repetitive behaviors or mental acts that are done in response to obsessions or in a rigid, rule-bound way. The counting, that's a compulsion. Okay, the cleaning, the washing of hands, that's a compulsion, okay? Many have either only obsessions or only compulsions, but most of the patients present with both. Okay, hindi pa ako nakakita siguro. I haven't seen a patient that only has like purely obsessions or purely compulsions. No? Okay? Obsessions and compulsions are the essential features of OCD, an idea or an impulse that intrudes itself insistently and persistently into a person's conscious awareness. You're aware of it. You're aware of, kunwari, a sexual thought, pero you're so against that taboo thought. It's intrusive. It comes to your mind like, bakit to? Bakit ko iniisip to? So because it's so distressing to you, you don't like the thought of having this sexual thought in your mind, that you would do something to relieve it. They do the counting. The counting sometimes helps ease it up. There are others naman, they would do something like, kunwari, they would fix things pero in a certain order. And if they feel like hindi siya in a certain order, they feel like, no, I have to do it all again. Okay? Typical obsessions are associated with OCD include thoughts about contamination. This is very common. My hands are dirty, or doubts. I forgot to turn off the stove. Kaya checking. Always checking. Checking knobs, checking locks, checking doors. No? Typical patterns of OCD symptoms cluster within several limited dimensions, including contamination cleansing, forbidden thoughts or checking, symmetry and ordering, and hoarding symptoms. So there is also discussion later on hoarding. Okay? Most patients with OCD typically have insight. They know what they're doing. Okay? And they know that their OCD beliefs are not real, but they can't help it. Okay? Some patients though, they have poor insight, and a small number lack any insight. Parang it's reaching a point na delusional na or psychotic na. Okay? So these are the presentation of obsessions and their compulsions. Okay? So most common is the obsession of contamination, and the compulsion is washing, no, or compulsive avoidance. I have a patient who has this intense fear na baka magkasakit siya. He would let other people hold the doorknob or open the door for him. But he will never ever touch the doorknob. Okay? When he touches the doorknob, he will not go inside the clinic. He will wash his hands several times muna. But there's a specific number. If he doesn't do it that specific number of times, it's not enough. Okay? There are others nga, as bad as after using the soap, they will throw the soap away. Yung bago ha. So they will keep a hoard or a stash of unused soap. That's expensive. Diba? Meron ganon. Ganon kalala ang OCD. So don't go around and telling yourself, you know what, I have OCD. If you're around dealing with people, most likely hindi naman OCD. Baka you have OCPD. Okay, that's different. Then we'll discuss that briefly later, although hindi siya kasama dito. Okay? What happens though when there is excessive cleaning or washing? They may rub skin off their hands by excessive washing. Okay? And they are usually unable to leave home. Kasi takot silang madapuan ng dumi, no? Or sometimes, I have this specific lady na patient. whenever she sees dog poop, she cannot leave anymore. She would go back home and wash 10 times. Because she feels like kahit makakita lang siya ng dog poop, na-contaminate na siya at dirty na siya. And she had a history of not even related to dog poop. It's sexual assault. Okay? Anxiety is the most common emotional response, no, for contamination and cleaning. And obsessive shame and disgust is also present. The next one, the second most common, is the pathologic doubt and checking. So the obsession is doubt. They're never, hindi sila sure. Always. They always have this nagging feeling na may kulang. Na baka may hindi nagawa. Baka hindi nyo ginawa, ako na mag-check. Baka hindi mo na-lock. Baka may mangyari masama. Okay? Their compulsion is checking. The obsession implies danger of violence. No? Not locking doors. So feel like baka may intruder, baka may mangyari masama, baka may pumatay. No? There is obsessional self-doubt and guilt about forgetting or committing something. Okay? The third most common, intrusive or forbidden thoughts. It's usually sexual in nature, or intrusive thoughts about dying or of suicide, no? Yeah, sexual aggressive acts that are reprehensible to the patient. Minsan, even thoughts of killing another person. Okay? The compulsion is usually none. There are some though who report themselves to the police. Kasi they're afraid na baka may gawin sila. Kahit na wala namang history. Wala naman nangyari, no? Suicidal ideations may also be obsessive, but actual risk must be assessed. Okay? Because they may say, you know what, doc, I always have this thought that goes into my mind. I see myself hanging with that, no? Pero I'm so afraid of the thought, I don't know what to do. So sometimes they would go like to the doctor or they would go to the police. No, merong iba, doc, parang feeling ko kasi makakapatay ako. Have you ever had this rage towards someone? No. Pero it keeps popping up in my head. Ganon. Okay? The fourth most common is symmetry and ordering. So the obsession is symmetry and precision, and the compulsion usually causes them to slow down because they want to be very, very sure about what they're fixing. If there is something in disarray, they would either do it all again and then start again. Okay? They can take hours to eat or shave because they are so precise with everything. Okay? Other patterns, religious obsessions. Okay? Compulsions, hoarding, hair pulling, nail biting, no? Some patterns are related to OCD, and also see that masturbation may also be compulsive. This includes females, hindi lang sa males. Okay? I've had patients who do this, no? I have had male patients who masturbate 3 to 4 times a day. Okay? And there are also females who masturbate that much in a day. Imagine mo, do they even nakakapagtrabaho pa ba sila? Okay? Do you have questions? Yes.
OCD also, parang mag-link ko siya sa body dysmorphia.
We will discuss that later. We will discuss that later because Tadaan! Nagbasa siya! In fairness, okay. Body dysmorphia is another disorder related to OCD. There is persistent preoccupation about one or more perceived defects or flaws in one's appearance. Kahit na hindi mo naman siya, wala namang nakikita sa'yo ng ibang tao. Pero when you see yourself in the mirror, you see a distorted image of yourself. Okay? The defect or flaws appear slight or are not even observable by others. So hindi siya napapansin. Okay? Their concerns about their appearance result in a range of mental acts or behaviors, no, including comparing themselves with others, checking in the mirror, always checking, selfie, 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 no, or camouflaging their perceived flaws. That's why there's plastic surgery. Yes. Most common concerns usually involve the face and head, particularly those involving specific parts like the skin. Very common, di ba? No shape, kaya maraming nagpapa-rhino, okay? and size and of their body and hair, although symptoms may focus on any area of the body. The concerns may be vague and confusing to understand, such as extreme concerns over kunwari a scrunchy chin. Parang masyado kumukulubot yung tapa ko. Diba? Pero for others, it is a genuine concern. Like, I want this fixed. I've had patients who as young as 15 who want to undergo plastic surgery. They want to fix their entire face because when they look in the mirror, all they see though is ugliness. It's sad, diba? And she was beautiful. Like, what don't you like about your face? I was waiting kung may specific siyang sasabihin. I hate everything. I want to fix my nose, I want to fix my chin, my cheeks, I want to fix my forehead, my eyes, though my eyes are horrible. Gumagano siya. Okay. Like she feels that is the only way that she would rid herself of this torture. Kasi for her, it's torturous to have that sort of face, no? Okay? Throughout their illness, patients worry about 5 to 7 different body areas. Imagine that. And then more than a quarter of patients are concerned with the symmetry of their appearance. Baka hindi pantay, no? Their cheeks, they have a bigger jaw than this one. So marami, kaya patok ang aesthetic medicine and plastics, okay? If you want money, go there. Okay? Commonly associated symptoms of body dysmorphia, ideas or delusions of reference, frequent mirror checking or avoidance of reflective surfaces. They either want to have a mirror all the time or they don't want to see themselves at all. Okay? They try to attempt to hide their presumed deformity. You notice those who, di ba may mga shows or documentaries about the extreme, like, yes, that's usually body dysmorphia. I've encountered someone in the airport, she had these humongous, alam kong filler lips siya because they're so disproportionate to her face. And I see that she has done so many things already. That's like, nag-uusap kayo ng psychiatrist friend ko. Do you see body dysmorphia? I said, yes. I wonder how she's feeling, no? Pero siguro they're never satisfied with the way they look, okay? Significant impact on life. You assess for avoidance due to body dysmorphia, which can range from minor social avoidance to being housebound. Okay, so there are others who would rather go under the knife first before presenting themselves to the public. Okay? They have less insight into the truth of their beliefs than those with OCD, actually. There's around 1/4 with reasonable insight and around one third with no insight at all. So that's why they go through, the surgeries, no? Next, hoarding. Iba to sa collecting. You collect certain things, but hoarding, they just hoard everything. This is persistent and profound difficulty discarding or parting with their possessions. It causes a lot of congestion and clutter and substantive distress or impairment, differentiating it from regular collecting. So yung collection mo, kapag collecting toys ka, Legos, records, usually maayos siya. Pero this one is just like, you know what? I don't want to throw this piece of paper because I might use it later on. You know what? I don't want to throw this expired makeup because I might use it later on for, I don't know. You know what? I'm not going to throw away this tissue because I might use it later. For whatever purpose yun. Pero ganon, lagi silang may justification for things that they keep or things that they have trouble letting go. No? Compulsive hoarding is a common and often disabling phenomenon associated with impairments in such functions as eating, sleeping, and grooming. So usually, makalat ang bahay nila. I have had a patient with schizophrenia who hoarded like tissue. Used, unused tissue, nagpatong-patong na sa loob ng apartment niya. I don't have a picture of it, but I was sent by one of the nurses na sumundo sa kanya sa apartment niya. Because this patient is actually a very good patient of mine. Masunurin, pero the problem is wala siyang social support. No? Lahat ng relatives niya is in another place and he was by himself in an apartment. So he was hoarding everything. Like when he would come to me to the clinic, he would have this big backpack of papers, like documents. When I ask him, anong dala mo? I have my records from here, I have my prescription from here, I have newspaper clippings from the last election, ganyan. I was like, do you need all of those? I might need it later, Doc. Why don't you discard it? It seems na gutay-gutay naman na yung iba. No, I can't let it go. It means something to me, and I might use it later, Doc. Baka magamit ko siya mamaya. It was hard to deal with him. Pero at least now, he's much better. He's actually admitted in a long-term facility kasi wala siyang bantay. And he was actually becoming malnourished. He had poor grooming. He was not taking care of himself, so that posed a risk on his health na rin. So he was emaciated already and wasn't eating. So sabi ko, hindi, pa-admit na lang para at least mabantayan. So now he looks healthy. So kahit na naka-admit siya, at least okay siya. So yon, health problems, poor sanitation, that's what's happening to my patient that time. Particularly when hoarding of animals is involved. Imagine those hoarding cats, dogs, yon, chickens, birds, no? And sometimes they don't even clean up anymore. May mga documentaries about the hoarders, no? Extreme hoarders ba yun? Yes, that is wild. And when they start cleaning, diba, they become very emotional. So it's like that, okay? Okay. They have this fear of losing items that the patient believes will be needed later. Diba nabanggit ko kanina? Or this distorted belief about an emotional attachment to possessions. They do not perceive their behavior to be a problem. No, this is completely normal. I don't have a place to sleep, but this is normal to me. Okay? Reasonable and part of their identity. They feel like if they lose this particular item, parang they lose a part of themselves. Okay? Passively accumulated, newspapers, mail, magazines, old clothes, no? Bags, lists, notes. You can't just get rid of it. You know what? They really have trouble parting with these items, okay? The clutter led to deaths from fire or other accidents, and syempre pest infestations happen and they pose a health risk, okay? The pathologic nature of hoarding disorder is due to the inability to organize possessions and keep them organized. Parang okay na sana if you're a collector of these memorabilia, but they have trouble organizing them, okay? Many of these patients hoard rather than make decisions about discarding items. So they just can't let it go, okay? They overemphasize, again, the importance of recalling information and possessions. They will keep old newspapers and magazines because they believe that important information may be lost. But they haven't heard of the internet and social media, okay? Pero for them, these material things, it matters to them. I think it's regardless now of the content, okay? They believe that forgetting the information would lead to severe consequences. So it's like the obsessions, diba? The compulsion is to keep things. Okay, so that's for hoarding. This is trichotillomania or hair pulling disorder. Okay, chronic disorder characterized by repetitive hair pulling, leading to variable hair loss that may be visible to others. Ang tawag doon sa Tagalog? Poknat? O, yun. It is also known as trichotillomania, which is a term coined, trichentillin. This is French, okay? Francois Halopo, I don't know how to pronounce that. I don't know if I'm ruining the name. Halopo. Chitang corny. This is actually relatively common and resembles OCD and impulse control disorders. I will show you one. This is an actual patient of mine. This is her picture. She's hiding it with a tuft of hair. She covers it here. Okay, sa clinic ko yan. Okay, there is focused pulling. No, dito lang. Diyan lang sa may gitna. Okay? This girl, she is 14 years old. She had a history of sexual abuse by an uncle. Okay? But the uncle is still living with them. So every time she's stressed, she would pull her hair. Every time na nakikita niyo yung perpetrator. And every time they would reprimand her for, wrongdoings man, she would start to pull. Papagalitan pa rin siya because people don't believe her. It's sad. Okay? So there's focus pulling and there's automatic pulling. The focus, intentional act to control unpleasant personal experiences, such as urge, bodily sensation, or thought. And automatic pulling, it's outside of the person's awareness. They don't, minsan parang, ay, I'm already pulling my hair, I don't even know. There is also like trichotillomania, na kilay na uubos. They pick their eyebrows. That happens, no? Sa kids, makikita mo, wala siyang isang kilay. So they would be picking it. No? And it's usually in response to stress, okay? Yung itsura ng buhok or ng scalp, there are short, broken strands near long, healthy hairs in the affected areas. But you have to take note that there are no skin or scalp abnormalities. Walang problem with their skin, there's no dandruff, there's no anything, no? And trichophagy or the mouthing of the hair may follow after plucking. Kaya nagkakaroon sila ng bezoar. Okay, malnutrition, intestinal obstruction. We've had one when I was a clerk in JBN. They had to do an explore lab sa bata because in the x-ray may bezoar. Ang laki, like, huge, no? So, hindi ko alam kung na-refer pa sa DSWD or something, pero there was suspected trauma or abuse. Excoriation or skin picking disorder. This is when you repeatedly pick skin sufficiently to cause lesions. Hindi to basta-basta skin infection. This is intentional. They're picking their skin. Like they're scratching it until they bleed, until they form these lesions. No? Individuals with skin pulling attempt to decrease or stop the skin picking or pulling. However, they have difficulty doing so. Okay? It can happen on any part of the body, but most common yung sa face, followed by the hands, fingers, arms, and legs. For severe cases, multiple sites are involved, and it causes disfigurement, no, and medical consequences. I have another one. This is an actual patient. Again, she was picking her ear non-stop. As in, akala ko like there's an infection. Pero doc, sabi niya, no, this was fine before. But when I started experiencing what she was experiencing, she started picking and picking and picking until ginagawa niya, tinatakpan niya yung buhok. I come to know about this when I asked her, why do you keep covering your ears? So she showed me. Doc, nahihiya ako sa tenga ko. So, how come? Can you show me? So pinakita niya. This is what she was doing. She was picking her ear. She was like scratching it, no, to the point na nagkakasugat na. Okay? They usually experience tension before picking, and there's relief and gratification after picking. It relieves stress, tension, and other negative feelings. Siguro is something similar to those who cut. No, they have that sort of sensation. No, may satisfaction sila that they get from it. But after that, there's guilt. And then after that, it makes them feel, like this tension and stress again. So it's a cycle. Okay? See, around 87% of patients report feeling embarrassed about it. And 58% report avoiding social situations. About my patient, she had trouble going out. She avoided like invites from friends, like tara, labas tayo, kasi she was ashamed of her ears. No? So they use bandages, makeup, or clothing to hide their picking. In this case, she was using her hair. She had very thick hair, so she would cover her ears. Okay? Around 15% report suicidal ideation due to their behavior, and about 12% already have attempted. Okay? So there are OC or related disorders due to another medical condition. So you have to rule this out again. It can be due to anything, no? Medical problems, hyperthyroid, no? NSF, stroke, cardiovascular problems, pulmonary problems, no? Substance-induced OC or related disorder, and other specific OC or other related disorders like olfactory reference syndrome. Look it up. Okay, how to diagnose? You have this is in the DSM-5. So this is the criterion A, presence of obsessions, compulsions, or both. The obsessions again are defined by recurrent and persistent thoughts, urges, or images that are experienced at some time during the disturbance as intrusive and unwanted. You don't like it. It's happening to you, but you don't like it. It's unwelcome. That in most individuals, it causes marked anxiety or distress, and the individual attempts to ignore or suppress such thoughts, urges, or images, no? To neutralize them with some other thought or action by performing a compulsion, be it counting, fixing, cleaning, no, checking, okay? So the compulsions are defined as repetitive behaviors, no, hand washing, ordering, checking, as mentioned earlier on the table, okay, or mental acts. They do the praying, counting, repeating words silently para ma-neutralize yung obsessive thought na yun. Okay? These acts are aimed at preventing or reducing the anxiety because they feel so worried about their thoughts, okay? Or preventing some dreaded event or situation. These mental acts are not connected in a realistic way that with what they are designed to neutralize or prevent, okay? I've had another patient, although there is a comorbid autism spectrum, pero mild autism spectrum. He was diagnosed with OCD. He wears the same clothes like every day. He wears the same white t-shirt, he wears the same blue jeans, and wears the same pair of shoes, okay? Buti na lang may multiple siya, supply of these, yung damit niya. Whenever he goes to the clinic, he uses his elbow to like slide the door or to push the door open. And then sometimes depende sa situation, there is a way dapat of opening the door, and there is also a way of entering the office. He would say na you can't face like this way, like to go in the door. You have to face the other way, and then he would go around. It's like, okay. Then kunwari he would remember, I came in the wrong way. What do you mean the wrong way? So he had to go up. He got up, went outside, then he went in again. Like following na dapat yung correct way of going. Kasi he feels like, no, I can't, I'll feel restless, I won't be able to sleep tonight if I don't fix it now. It was that debilitating. And the height of his symptoms were during the height of COVID. He hates wearing a mask. And he had to travel back abroad. I won't say where na lang. Basta abroad, back. So kailangan kasi diba dati, we're required to wear masks, right? The father had trouble explaining to authorities na he has OCD. And he has trouble keeping a mask on. So he had to go through yung security checks and everything. You have to remove everything. That is one of his biggest struggles now. When they get into the plane, he would ruminate about not going through the security check properly. One time, there's also this story. He went to Boracay with his family. Di ba minsan yung mga ilaw-ilaw, the lights, there were lanterns, no? There was one lantern out of place. He saw it was out of place. He wanted to do something about it, but they didn't do anything about it. Kasi like, okay, wala naman talaga tayong pake. We're just passing by, you saw this particular lantern uneven. They went home. He pleaded to his father, let's go back to Boracay. Because I will not be able to sleep. A week later, they're back in Boracay. Nandun pa. Dahil pera, diba? Yes, when I was hearing the story, I was like, okay, this is not helping with the OCD at all. Kasi it's supposed to be exposure and you're supposed to prevent the response because that's one of the treatments, right? But this one, it's more of like, kinukonsente mo lang. Supportive, but in the wrong way. Because siguro, the father was also panicking because it's like, I want my child to feel relaxed na. Okay? Buti na lang mayaman sila. Because they wouldn't afford to go to Boracay like, just like that, no? But that was one of my severe cases. This person underwent deep TMS, transcranial magnetic stimulation, for 1 month. There was significant improvement of symptoms. And they went back abroad, they continued the treatment with TMS kung saan man sila ngayon. So, mukhang okay pa naman sila. Kasi the father would update me every now and then na, okay po, sige nito. Okay, that's good to hear. Ayun. Pero that was very difficult. I tried so many medications with him. So, that was an extra challenge. Okay? So again, we have to specify if with good or fair insight, with poor insight, or with absent insight or delusional beliefs. And there is also tic or Tourette's. There is associated OCD with those syndromes. No? So you have to specify if this is tic related as well. Okay, this is just the DSM-5 criteria for hair pulling and excoriation. I want you to read this because this is in your books or in your PDF. It's weird to say books when they're not actual books, no? When they're just like files, like, yeah. Okay, comorbidities. In OCD, very common, depression, okay? Around 67%, and for social phobia, they would get around 25%. Suicide is a risk for all patients with OCD. And other common comorbids include alcohol use, GAD, specific phobia, panic disorder, eating disorders, and personality disorders. Okay? OCD, ano ba yung mga comorbid niya? I mentioned earlier, OCPD, Obsessive Compulsive Personality Disorder. Again, this is different from Obsessive Compulsive Disorder. Okay, they are not the same. OCPD, it is more like you're concerned about perfectionism. You know, you like to be detail-oriented ka. If you have something scheduled today, you want to follow that schedule. You get angry or irritable when you don't follow that schedule, but you're not like the OCD na may compulsion kang gagawin. Okay? Tourette's disorder is also common, around 5 to 7%, and 20 to 30% of patients with OCD have a history of tics, hence the specifier. Okay? For body dysmorphia, usually there is associated depression with a lifetime rate of 75%. Suicidality is also quite high at 80%, no? And about 1/3 of body dysmorphia have a lifetime history of OCD. So meron din, okay? And they experience panic attacks triggered by appearance concerns, okay? High levels of rejection sensitivity and low self-esteem. So they use substances to self-medicate. Marami sa kanila use cocaine, cannabis, no? Shabu if available. Hoarding disorder, OCD, again, is a common comorbid. Other prevalent comorbid disorders include GAD and MDD, or major depressive disorder. For hair pulling, OCD is also more prevalent. Okay? And hair pulling can also result in medical sequelae like the trichobezoars, no, and decreased quality of life if not managed. For excoriation, OCD and BDD, or body dysmorphia, are also more prevalent in excoriation disorder. So what is the course and prognosis? For OCD, this is chronic and may persist for decades. So it's more of like a lifelong thing if you were to, consider lahat yung functional years mo. Long-term outcomes, for some can be positive. They are always encouraged, of course, to remain hopeful and try evidence-based treatment. That's why we're not limited anymore to medications lang. We also use like the other modalities like the TMS, deep brain stimulation, to help with the symptoms of OCD kasi we're targeting specific areas of the brain. Okay? Body dysmorphia, this is chronic and may persist for decades. For hoarding, it has a later course than most obsessive-compulsive disorders. And this is chronic and progressive that often begins in childhood. And there is worsening of symptoms in subsequent decades. So usually pag medyo tumatanda na sila, dun lumalala ang hoarding. Okay? For hair pulling disorder, there is little data. It is chronic without intervention, but in some cases there is remission. Okay, excoriation, also the same, limited lang. This is also chronic without intervention, and it fluctuates in severity over time. Usually they do not seek treatment because of embarrassment. Okay, they are unaware that their symptoms may be part of a known condition with available treatment. So it's sad. If you know someone with this, please tell them na may help naman. Okay? For pharmacotherapy, we use clomipramine as one of the first lines and SSRIs and SNRIs. Okay? In general, clinicians must use higher doses than those that we typically give for kunwari, depression, ganyan. So for them, mas makikita namin effective ang higher doses. Okay? We've had this recent convention in Australia last June, and they did agree na they had this consensus that we need to give like beyond the usual dosing range for specific medications when managing or treating obsessive compulsive disorder. So like for example, fluoxetine, we usually give only up to 60 milligrams. But for OCD, we can go as high as 80 milligrams. And for sertraline, our usual dose is 50 to 100 milligrams only. But for OCD, for it to be effective, we have to give at least a minimum of 200 milligrams. Exceeding the recommended dose is not advisable, however, for clomipramine or citalopram due to safety concerns. No, may mga cardiovascular side effects. No, SSRIs have a slower response in OCD than in depression, so that's why we have to give it ample time, around 12 weeks minimum, before we say that there is treatment failure or before we decide to augment with another agent, like usually an antipsychotic like olanzapine, risperidone, or with even a mood stabilizer like valproic acid. Okay, the most extensive evidence base is for antipsychotics in adult OCD. Best supported adjuncts are risperidone and aripiprazole. This is also particularly useful for those with tics, but not all data are consistent. For with children, this is also the safest option, and it's usually the first time that we give for children and adolescents with tic disorders or Tourette's. The response usually happens relatively quickly in just as little as 4 weeks, so mga 1 month. No? When using DRAs, it is crucial, of course, to monitor for adverse events. Like for example, in risperidone, what is the usual thing that patients would complain of when they're starting to manifest with these adverse effects? Risperidone. For females, it's usually galactorrhea or menstrual disturbances, no? Amenorrhea sometimes. For males, may gynecomastia. They will start to develop breast buds when they're not supposed to, you know. So that's one of the things that you have to check, okay? Kasi may increase in prolactin because of the risperidone. For aripiprazole, this is quite it has a good profile, except we have to watch out for what is the common adverse effect related to giving aripiprazole. It's like, you know, EPS. EPS also can be seen in risperidone, pero in aripiprazole, what do you call it? That restlessness, you can't define, you feel like you need to move your legs all the time. Akathisia, okay? Okay. Other augmenting agents, those that we don't usually consider na giving in psychiatric cases, memantine, riluzole, ketamine, lamotrigine, and acetylcysteine is also being studied in the management of OCD. Okay, again, my patient's father was not helping kasi ini-expose niya, pero he's not preventing the response. Although it sounds distressing and like parang torture yun, you expose them and you just try to hold them back from doing something about it. But that's the therapy. That's the treatment. Para matuto sila na behaviorally, if you don't do anything, like you can observe, nothing bad will happen. Okay? Has proven to be a particularly effective component of treatment with more recent work also focusing on the potential role for cognitive and mindfulness approaches. Do you feel or do you believe that these modalities have the capacity to change the connections in your brain? Yes or no? Yes or no? Because there is a concept we call neuroplasticity. Okay? Your brain starts to form new connections. May synaptic connections na bago kasi you're trying to develop this. Ito na dapat yung susundin mong pattern ng behavior para ma-eradicate yung luma. Okay? Kaya siya effective. Kaya mga behavioral therapies, the psychotherapies, they are effective, just as effective as medication because it has the capacity to change your neuronal connections. Okay? That's why neurology and psychiatry and neurosciences is such a beautiful field. Diba? Ano? Okay? Diba? It's fun. Don't you think? Yes? Or parang napipilitan mo kayo with this? Okay. So we try to minimize avoidance of distressing cues and instead to encourage in vivo exposure to feared situations and imaginal exposure to feared consequences. So yung mga situational na, yung situations that would somehow provoke them into developing these obsessions na naman. And they would try to do something about it. So we try to provoke them while in the clinic. We also do the provocation right before they do the deep TMS, deep transcranial magnetic stimulation. So we would know the difference. This patient of mine is also has this aversion sa tissue na nahuhulog. Yung tissue. You have tissue, it's very light, diba? And then you drop it from a height. He doesn't like it when it does this. So what he does, he looks for something solid, he tries to put it on top of it. So we did that provocation in front of him before we did the deep TMS. So we dropped the tissue in front of him. Parang torture, no? So we did that. So it's like, I want to put something on top of it. You can't. Doc, I really want to put something on top. No, you can't. You stay in your seat. And then we started the deep TMS. Then after 20 minutes, we dropped that tissue again in front of him. Do you have an urge to do something about the tissue? Not anymore. Around 50% nabawasan. Medyo may konti pero nabawasan siya. As opposed to the ones that he started with, na talagang he wanted to put something solid like on top of that tissue. He also did that to the falling leaves from their tree sa backyard nila. They tried to he wanted to put something like stone, like rocks on top of the dish. Eh buti na lang siya, kasing malaking puno na malalaking dahon. What is that tree? Oh my God, can you mention a tree na very common? Ano no? Hindi sa akin. Hindi yung medyo, yung parang umbrella tree. Umbrella tree? No, hindi. It's not. No, it's not. Umbrella tree. Huh? Wait. Baka meron tayong gidahon sa labas. Ay, wala. Basta, it's like this umbrella tree. Malalaki yung dahon, ginagamit siyang shade minsan. Dito sa Pinas. Marami yan. Look for umbrella tree. Like, medyo malalaki yung dahon nila. But it branches out by layers. Oh my goodness. I can't. Hindi mo mapakali. Umbrella tree. Saan na ba yun? Umbrella tree. I forgot the Yeah? Talisay. Talisay. Alam niyo yung talisay? Yun. Ganun yung puno nila sa likod. Yung talisay, yung malalaki yung dahon nila, diba? So yun, every time na nahuhulog daw, he wants to put something on top of it. Okay? Okay, other approaches? It focuses on the thought distortions, okay? The therapist and the patient try to collaborate to test such distortions and replace them with more adaptive thinking. So family sessions is also important so that hindi sila maging enabler. Okay? Because they have to understand that they have to help the patient resist that urge to do something about it or to respond to that distress. Okay? So combined treatment is, of course, the best approach. We have to do a combination of pharmacotherapy and psychotherapy as the first line for the management, okay? For younger patients, it seems reasonable to begin with cognitive behavioral therapy first. For those with severe or comorbid depressions, it is imperative that we start with pharmacotherapy first before initiating CBT, because there is a criteria before we start psychotherapy. So not everyone is eligible for psychotherapy on the get-go of treatment. Okay? For some with severe depression, for severe psychosis, we need to manage first with medications until they are able cognitively to listen to you or to at least engage in conversation. Okay? Other somatic therapies, targeted neurosurgical lesions, they have been, parang yung iba, they would excise these, no? Deep brain stimulation, transcranial magnetic stimulation has been studied, no? And electroconvulsive therapy does not have any use. Okay? Maganda lang siya for severe depression, for psychosis, delusions, no? Okay? Okay, SSRIs again are efficacious, including delusional body dysmorphia. Okay? The duration should be longer with gradual tapering of dose and close monitoring of emergent symptoms. So patients who do not respond to one SSRI may respond to another. Okay, buspirone augmentation is useful in partial responders. And aripiprazole again. Aripiprazole is a versatile drug. No? Marami siyang gamit. Okay? Again, it is marketed as an antipsychotic. Pero marami siyang use. Meron for anxiety, meron for depression, meron for OCD, meron for body dysmorphia. So it is samut-sari. Okay? We just have to learn how to explain to our patients kung bakit they're being given a certain class of drug. Okay? Body dysmorphia in relation to plastic surgery, we only have few data. The lady looks like this, I'm sorry. Dun sa airport na nakita ko last week. Ganyan yung like popping lips. I feel like if you touch them, they're gonna burst. Okay. There are others, ayan, removal of facial sags, jowls, wrinkles, or puffiness. Rhinoplasty is very common, very accepted. Okay, breast reduction or enhancement. And for males, penile enlargement. Yes, men who request penile enlargement and women who request cosmetic surgery of the labia, of the vagina, or the lips of the mouth may be suffering from this disorder. Okay? Kasi hindi sila, feeling nila they're not well endowed or they're being criticized by the size of their member, so they try to enhance it using surgical means. Okay? This is commonly associated with the belief about appearance, no, is an unrealistic expectation of how much surgery will correct the defect. Okay? Hoarding disorder, again, is challenging to treat. Siguro if you watch, no, extreme hoarders, malala ang emotional tension, okay? Or only 18% of patients responded to medications and CBT, so it's quite poor, no? The challenges posed by hoarding include poor insight into the behavior. They feel like, this is not a problem, what are you talking about? So yung iba, is like, bahala ka dyan. Pero, more than the psychiatric problem, it's usually the medical problems, no? Due to the infestation, the malnourishment, yun yung nagiging problems that usually brings them to the hospital. Okay? Okay. Hair pulling, they respond to clomipramine. The most significant positive clinical trial to date is with N-acetylcysteine. I have not tried it yet kasi nabawasan yung mga OCD patients na pumupunta sa clinic ko. Pero if ever meron, I might try it. Okay? It has a favorable side effect profile and NAC as a first-line agent in adults with hair pulling disorder. So malay mo, may dumating and I'll try it and we'll see. Okay? Other therapies, habit reversal training or HRT awareness training is competing for response training and social support. Another one is stimulus control to change the patient's environment. So hair pulling is more effortful or less reinforcing. So maybe ask them to wear a hairpiece or something para to prevent the hair pulling. No? Excoriation is challenging to treat. They say that SSRIs perhaps can be given, pero there's really no guarantee. Okay? Studies comparing fluoxetine against placebo have shown fluoxetine to be superior. We give fluoxetine even with OCD sa children, adults, no, at high doses, like 80 milligrams. And that's when we see improvement or effects. I had one girl na online consult lang siya, pero she had these recurrent intrusive thoughts of sex. No? She's 14, pero she has this thought about going into an orgy at 14 years old. So for her, it's like, I don't want that thought. Like, where's it coming from? So I had to give like in ascending, like, you know, in increments until we reached 60 milligrams, buti na lang tumalab na sa kanya. And we stayed at 60 milligrams for 1 year and we tried to taper it off. And so far, so good. Okay. Okay. OCD has a lifetime prevalence of around 2 to 3%. Females more than males, but clinically, your presentation is quite even with a mean age of 19. There is early onset in males, no? And for adolescents or childhood, meron din onset, but it's rare after 30 years old. For body dysmorphia, the prevalence is around 1.7 to 2.4, higher in females, but roughly even presentation in males, no? Okay, the onset is usually in adolescence. Hoarding, 1.5. Females more than males. Again, so halos lahat females more than males. Average for hoarding is 50 years old. Mas older. Kasi sila mas problematic na sabihan, Ma, wag mo na i-hoard din. Hindi na natin kailangan yan. But it's hard to tell them, diba? Okay? So tandaan nyo, usually parents are hoarding. Okay? So prevalent in Western countries. Okay? Pero malay mo baka sa Pilipinas meron din hoarders. Pero in the form of old plates, Tupperwares, ano pang tinatago nila? Lumang kortina, mga mantel ng okay, mga pinaglumaan na damit ni so and so. Okay. Hair pulling, onset is usually during menarche. For excoriation, mean age is 12 with a variable onset. Okay? Etiology. Actually, last slide. Okay? OCD, there is this cognitive inflexibility and alterations in habit system. So yung mga pangalawa dito, the second row, these are the neural circuits responsible, no? Okay? The neurotransmitters involved in OCD, 5-HT, dopamine, glutamatergic, and GABA. And there is a genetic susceptibility for almost all of these conditions, okay? For body dysmorphia, deficits in executive functioning. For hoarding, there's neuropsychological domain impairments, spatial planning, working memory, and response inhibition and set shifting. Okay, for hair pulling, there are deficits in working memory and visual spatial learning. And excoriation, there's usually an overlap with OCD regarding motor impulsivity. Kaya yung iba, they would usually respond to, what do you call this? Uy, nasa-startle siya. Or baka inaantok lang tayo. Okay? So motor impulsivity, kaya minsan effective ang mga mood stabilizers to control like the impulse. Okay? So yan, most of them have problems with the dopaminergic system. And again, all of them have a genetic susceptibility. Any questions? In fairness, before, yes. Yes. Yeah. Ah, okay. Pero kasi what is described in the book is more of like the physical things. But maybe we have to explore digital hoarding. You're giving me an idea. Oh, sige. I will give you that answer the next time I teach. Okay? Kasi, yes. Naiintriga ako doon. Sige. Pero I like that question. Oo nga, kasi wala kasi yung digital data in the books yet. No? Even the latest DSM-5 and the latest Kaplan. So, I will look into that kung magkakategorize ba siya as hoarding disorder. Pero this one kasi is in the premise of like physical setting. That's why there are medical problems, there's a risk for fire, for falls, no, for physical injury to happen. Pero for that siguro is more of something that is siguro in a different realm or different context siguro siya. No? Pero yeah, tignan ko nga yan. Okay, sige, what else? Baka may question pa. Anyone else? Atat na silang umalis. Okay, if there's none, then that's the end of this lecture.